evening, Annette Quijano, and I'm sorry, Chairman, I didn't hear everything that you said.
Well, just tell me your town of residence.
Elizabeth, New Jersey.
And the resolution you are referring to.
I'm referring to 2015-844,
All right.
and I see I have a green light. So
Yep.
Thank you, Chairman, and fellow freeholders, for allowing me to speak on such a critical issue that could have a devastating impact on several urban safety net hospitals throughout the state of New Jersey, including our own Trinitas Hospital. The state legislature is reviewing the matter and will take appropriate action. Assemblyman Holly and I have had meetings and discussions with the Assembly leadership regarding this plan. The Senate held an in-depth committee hearing requesting that the Attorney General investigate whether New Jersey's largest health insurer violated antitrust and false advertising laws in developing this new plan. The Attorney General has agreed to investigate. Trinitas Regional Medical Center in Elizabeth saw nearly 500,000 visits last year from Union County residents. These are working families with limited incomes who can't afford thousands of dollars in out-of-pocket expenses if an emergency arises that requires a hospital visit. These are families who are limited due to a lack of vehicle or reliable transportation travel outside of this area for medical treatments, checkups, and emergencies. This plan not only hampers their access to quality, affordable care, but it also jeopardizes the financial solvency of Trinitas and many other hospitals, shut out of the elite status of the classification we are promoted by Horizon. The exclusion of Trinitas is all the more surprising given the hospital's volume and proximity to such a large population. They had 18,000 inpatients, 73,000 emergency visits, and over 400,000 outpatient visits in 1 year. And the fact that it has been the sole Union County provider for Horizon's exchange product offered pursuant to the Federal Affordable Care Act, which Horizon surprisingly announced it is withdrawing in January. Many questions regarding the Horizon plan still need to be answered, and as state legislators and community leaders, we deserve answers. With Horizon's recent announcement forging a Tier 1 partnership with only 34 hospitals, who really pays less? What criteria was used to determine what Tier 1 is? Who would pay the increased cost for patients who visit more than half of New Jersey's safety net hospitals? With this new alliance with Horizon, which currently insures 3.8 million out of New Jersey's nearly 9 million residents, be it too constricting and manipulate the current healthcare market, will it lead to a monopoly? Furthermore, why now and why the rush? This resolution is justified in requesting the 90 days just to talk it out, seek further input, and allows us to communicate with more experts and our communities about the potential impact of this plan. Ultimately, we must do more to promote healthier lifestyles in our community. I had filed Assembly Bill 1331 in response, which I felt would encourage state employees to have incentives to be healthier. This bill would require a state health benefits program to create a New Jersey State Employee Wellness Plan. Some of this has already been started, but the bottom line is our community needs to do more in promoting, educating, and incentivizing preventive care. By doing more, we can prevent more costly visits to the emergency rooms in all the hospitals. I can also tell you that we have met with the president and CEO of Trinitas to talk with them. They have provided us with information, and I can tell you that I am happy that they're leading the charge. So I therefore respectfully request that the Union County freeholders pass this resolution requesting a delay so that we can gather in Trenton and to determine what is best for the state. Thank you.
Anyone else wishing to speak on resolutions being offered for adoption?
Good evening, I'm Sam Germana, and I work at Trinitas Regional Medical Center, so I'm from Elizabeth, New Jersey. I'm one of the administrators there and the general counsel. I echo what the previous speaker just said. For those of you, I think you're all familiar with it, this is a new product being introduced by Horizon, which provides insurance to half to two-thirds of the employees and the workers here in New Jersey. They set up this Tier 1 and Tier 2 system. Tier 1 is nominally supposed to be those doctors and hospitals who are of better quality. However, the criteria for this has not been articulated, and it's been set up in a somewhat vague and secretive manner. Therefore, many high-quality hospitals have been excluded from the Tier 1 Tier 1 ranking. And why does this matter? Because Tier 1 hospitals provide care to a rise of patients at a discounted rate, and thus Tier 2 hospitals are at a distinct disadvantage in this regard. The Tier 2 hospitals are mostly Catholic hospitals. There's only one or two that are included in that, and the ones that are in Tier 1 are primarily hospitals part of a large system. The claim by Horizon that those hospitals participating agreed to lower rates to attract patients and to accept discounts flies in the face that the Tier 2 hospitals never had the opportunity to address this whatsoever. So why does this matter? Up to 50% of patients who come to Trinitas Hospital come by public transportation. How are they going to get to the Tier 1 hospitals that supposedly would give them a discount? Thus, they obtain no benefit from this. In turn, the hospitals, such as Tier 2 hospitals, such as the independent hospitals, which are primarily penalized, are not able to treat the patients, and they are often safety net hospitals. But not only. Even though they claim that one of the criteria for Tier 1 is higher quality, among those hospitals that have been excluded have consistently rated extremely high in quality by objective third-party measures, including Trinitas. In fact, as the previous speaker noted, we have been selected by Horizon to be a marketplace provider under the Affordable Care Act because of our quality. We are now discarding that product and us with it. In summary, we believe that we provide quality services. That's not just our belief. It's substantiated by third-party independent criteria, and we heartily support this bill and urge you freeholders to accept it, pass it, and we thank you for the opportunity to allow us to speak to you tonight.
Thank you.
I'd like to talk about page 1, number 844. I just listened to Assemblywoman Quijano. Actually, she didn't introduce herself as you all know this. But anyway, but she brings up a couple of points, and then a fellow named Sam, because he's the administrator of Trinitas, brought up some points. And I've listened to the point. I didn't hear any counterpoints, so I mean, I can't weigh whether there really is an issue or not. But what I heard, it sounds like Trinitas, although they honor the Obamacare covenants, they're actually withdrawing from the Obamacare in January. That is a major concern if that's true. I don't know if somebody can verify that. And just another one that Assemblywoman Quijano mentioned, and she said that a lot of the governmental entities, are in programs promoting health. And yes, we had Sheriff Ryan come up here, and there was some tens of thousands of dollars for a MAX program. And it's great the government employees are having all these programs offered to them, and it's all free, but it really isn't free because the taxpayer's paying for it. And unfortunately, maybe we can't afford them to go to these programs because we're paying taxes to pay for the employees of the government to go to it. So, I mean, maybe if the government employees are offered a discount possibly, but, when you start paying for these programs for health, which is a good idea, unfortunately, it's all coming out of our pocket. And here we are, I'm not the greatest health myself, but I think you should really rethink about all these governmental programs for health and how it should be paid, because the taxpayers are crying out here because of all the taxes.